Hey, everybody, I'm here with a good friend, colleague. This guy's going to light you up, no pun intended, Dr. Kirk Gair. What's up, my friend? How you doing?
Hi, I'm doing great. How are you doing? Thanks for having
I'm
me on.
doing great. So for those who don't know Dr. Gair, he's a world-renowned speaker. He fluctuates in the world of chiropractic, sports injuries, low-level laser therapy, functional medicine. He turns a lot of turnstiles, if you will. And we've got some things coming up next year together that I'm very excited about.
Definitely.
But, Kirk, you have used laser to transform your practice and improve clinical
Mhm.
outcomes. What's with
Yeah.
this laser thing? Let's get some definitions. What's a laser?
So laser, it's like one of them I have is right here. This is the one you and I were the principal investigators on the GVL. So you can think of laser, light is necessary for life, pretty much. So you got a plant, it's sitting there, let's pretend this is a leaf. There are light receptors on there that when sunlight hits that plant, those light receptors can absorb the energy from sunlight and then turn into food. And that food doesn't just stay in the leaf, it goes everywhere throughout the body. So we got the same thing going on with lasers. The difference is we're not going to make food. Sunlight can hit our skin and make us make melanin for a suntan, or also with only penetrating through microns, it can cause you to make vitamin D, which will go all the way to your bones to make them stronger, go throughout your whole body to decrease inflammation and support the immune system. And with lasers, we're going to get some similar activity here. So if I laser on my brain here, I'm going to absorb that energy and it's going to trigger a whole cascade of reactions in the body. It's going to make electrons make different jumps and make reactions. We're going to make things like stem cells, which we see everybody talking about stem cells online. And hey, we're going to make them with the lasers. Our body's going to make stem cells. We're going to make the body stimulate new nerve cells in the brain. We're going to make extra energy by supporting the mitochondria. It's another buzzword right now in this post-COVID world with people having mitochondrial dysfunction, autoimmunity related to mitochondria. So we're going to support that with the laser, and we can enhance repair tissues at least 25 to 35% faster. I see sometimes, I'm sure you have over the last couple of decades. I know between the two of us, we got about 4 decades of laser experience in the room. I've seen things heal up, 70% faster. And I'm sure you've seen the same thing.
Without question. I mean, I piggyback on that. Outcomes are optimized not in just outcomes, but also in the speed. Laser for
Yeah,
me, that acronym, light amplification by stimulation, emission of radiation. It's all
right.
about photonic energy. And you and I
Mm-hmm.
are really going to delve into the idea of coherent versus non-coherent light. That's the
Right.
key. That is without
Mm-hmm.
question the secret
It
sauce.
is.
You just gave a great example, a quality dissertation on how taking in that photonic energy is really photosynthesis of the body. And the key
Yeah.
element there, which I know you're going to jump with real quick, is the idea of photochemical versus
Yeah.
photothermal. So
Exactly.
how is this high power infrared LED, basically the high energy laser? How did it
Yeah.
come about? What is it? And let's really delve into what it does.
So see, high energy laser, that's like what we got here with the violet and the green here. These are high energy wavelengths. So I like to talk about these ones as being like Einstein quantum physics kind of lasers working on the smallest particles. Whereas the ones that a lot of people are talking about with red light therapy and infrared that are thermal, they're more Newtonian. They're working on big types of structures. And you got to have like usually direct contact. It's going to have more of a thermal impact because the energy of those particular wavelengths are low. So you don't create these electron jumps. The easiest way to think of it is this. Let's say that you got a baby and this baby's in the hospital and it's got jaundice. What
Mm.
color light are you going to put it under? You're going to put it under a blue wavelength light because that's the one that is going to cause the right reaction to support the liver to get rid of the jaundice. You're not going to put them under an infrared, and no matter how much you crank up the power, you will never change what's going on with that jaundice baby because there are specific reactions with these energies, with wavelengths. So my analogy that I like to talk about with these wavelengths is the highest energy is violet, and then you got green, and then you got red. These are all high enough to make electrons jump. So it's kind of like in Back to the Future when Doc Brown was telling Marty, when this baby hits 88 miles per hour, you're going to see some serious, and you need that 88 miles per hour to make the DeLorean jump back in time. And if it went 87.9, nothing's happening. And that's the same thing here. We need a minimum electron voltage of 1.7 electron volts to make an electron jump to create photochemical, photoelectric, photosignaling types of reactions. And if you're below that, it doesn't matter how many DeLoreans you have, which is like a photon, you have 1,000 of them. if they're all below that threshold of 1.7, you don't make electrons jump. You create a thermal or a mechanical type of a reaction on there. And so there's these unique reactions that happen with each color of a particular laser device.
Each color is a wavelength, as you said.
Correct.
The red wavelength, we're not going to say red light because we want to differentiate. The red wavelength is approximately 635, which has ample electron volts to cause what you say, have an electron jump to the next valence level. Then you go down the wavelength and you get to green, which is 520, having different properties than the red, working in synergy with the red, if you will.
Exactly.
And maybe the king of them all is the 405 nanometer violet light, which has the most electron volts. So the takeaway here is the lower the wavelength, the higher the electromagnetic transfer of energy. And therefore, the GVL, which we talked about, is the most energetic laser in the world. That's the one that you referred to earlier as the one that we did and got an FDA clearance.
This one right there.
So the one you have in your hand. So you know what to say is, how is that laser different than every other laser?
Yeah. A way it's different than every other is this is the only one that's got the FDA clearance for chronic neck and shoulder pain that we got through peer review. So it is the highest energy one there. So you can, if you take a different laser, that let's say infrared, and I know we're not saying that to knock anything, it's just different. No matter how much you turn those watts up, which is just the dosage of those low energy photons coming out, they don't have the same reactions that this green and violet does. So when we look at, say, like the violet that's in here, that violet one with that really high electron voltage, it's not only great for breaking down scar tissue, you got all those immune applications. We've got FDA clearances for fungus, like for nail fungus, for the bacteria that causes acne. There's a lot of studies. This helped me a lot when I had COVID back way early in end of 2019. I was using the violet to help me overcome it. And there's studies on PubMed you can find showing violet wavelength is great for providing support for COVID infections, MRSA. You have all that unique stuff with that really high energy because of the way it supports macrophage activity. So we use that a lot in patients over the vagus nerve. I know you do the same thing because you got a lot of neurodegeneration, kicks off from bugs crawling up the gut and into the brain and triggering neuroinflammation. So I like to use that one to provide that immune support to patients. And then the green, I know you and I are both in love with that one because it's just amazing what you can do when you look at nerve regeneration because you're getting all that stem cell production. There's research showing it can support the formation of new cartilage, new collagen, new elastin. To me, it's like the fountain of youth kind of with some of these types of conditions. And I've seen it with patients who have had different tremors, have those disappear as we're using laser on them. And I had one patient who was in a car accident. He had a brain tumor as a kid, had grand mal seizures every week for the last 30 years. As we started using the green, the violet, and the red on his brain for his concussion after the accident, his mom said he's gone 6 months with no seizures at all. It's just, it's wild. You figure 30 years, and that's a huge change. You're not going to see that with, like, say, a red light therapy or an infrared light therapy to the same level as you do with this green, violet, and red combo on there.
You know, it's fascinating that, again, you and I are both in love with the green. You probably didn't hear me. I said marry it. But, you know, it still comes to my Passover meal is the violet and the red. There's a lot of good, and you really showed some interesting properties. But let me emphasize what you said. The green light helps with stem cell. The violet light helps with kill pathogens, and the red light has a medicinal effect on healing. Interesting from a functional medicine perspective.
Absolutely.
Or a nutrition perspective. You and I are both utilizing the laser because the violet actually has been shown to kill bacterial surfaces in hospitals for a 5.
Right. Exactly.
In addition to that, the violet's known to help with viruses, but the green light, which we unveiled in a 2013 study, actually has an effect on bacteria. So when you combine the violet and the green, you're able to help attenuate a lot of pathogens. And to speak to the brain and the gut, because we both know neurodegenerative diseases are bidirectional. Whatever you do to your gut, whatever you do to your brain, you do to your gut. You're going to illuminate both the brain and the gut and hope to get rid of some of these pathogens. So it's exciting, but the monkey's in the room. It's here. All we hear right now about is red light, infrared therapy. Now, I'll give you this. I use it to heat and work with my sauna, which I don't put So here it is. Here's the baton. Roll with it, my friend.
Yeah, so it's an interesting thing. because you see it a lot online where people will say, oh, you don't need a laser. A red light will do exactly the same thing. There's no difference. Well, first, you can get all these different opinions out there. Let's go to head-to-head studies. So when we look at head-to-head studies, if you use identical parameters where you've got the same dosage, the same treatment time, the same area, everything, head-to-head, which we've done that are double-blinded and quadruple-blinded for autism, chronic neck and shoulder pain, chronic low back pain, heel pain, and plantar fasciitis, every single time the laser outperforms the LED by at least 6 to 7 times the effectiveness on there. The bigger thing comes in when we do the long-term studies is that you'll see the LED will give some good improvements while you're using it, but as soon as it's stopped, then usually those symptoms start to come back. Whereas with the laser, we showed long-term benefits even at 12 months, that the patients continued to get better over the long haul. Now, I've had some people who are big light therapy, red light therapy proponents say, oh, well, the problem is you use too low of a dose. You needed to go way higher if it's red light. And there's a photon's a photon is a photon, whether it's a light or a laser, it's the same thing. And I would tell them, you just contradicted yourself. Because if an LED photon is exactly the same as a laser photon, you should get the same results with the same dosage. And when you can't do that, it is not doing the same thing. And so if we look at the research regarding this, there are different things that happen when you have a laser on there. And this one Russian researcher, Sergei Moskvin, is really great about talking about it. He said that, only laser therapy can do laser therapy. Only lasers can do it because it's different. You have this coherent signal. And the important thing about that is what your cells talk at. And I encourage all of you listening to this, go onto PubMed, type in ultra weak biophotons and do a deep dive in there, because you'll see that your cells will actually send laser-like coherent impulses from one another to talk to each other. And they send these packages of data, much like a download, like a flash drive, that are going through the microtubules like it's a fiber optic network. And it's going even through myelin sheaths. And if you look inside the brain, there are light receptors inside the brain. And the researchers were like, what the heck are these things doing here? It's inside the skull. No external light gets in here. The reason is your body talks to itself through coherent laser-like communication on there. And so when you put an LED on the body, you don't get coherent information. So when this signal gets into the myelin sheaths and the microtubules, the brain just filters it out like it's background noise. But if it gets a laser signal, it's like, oh, what's this? We know what this is saying. And you get a different result with that. And the laser energy can actually propagate further through the body as a result.
Outstanding. Some really great takeaways there. Number one, you talked about laser. There was a study, and you're the one who shared this with me, that if you lose laser and LED, the LED makes the laser ineffective. Number two, 6 to 7 times, like you said before, effective, short and long term. I mean, I have the data right here, and we can share that in the show notes. But let's get to coherent and versus incoherent. So coherent, like you said, is an absorbable form. It's this wavelength at the same size and color the whole way.
Exactly.
So the best way that I've seen to describe it is that I take this pen and I find a space right there and I hit it.
Exactly.
It's a bullseye, where that's coherent. Incoherent is I take paint and it splashes all over the place. So there's no direct line in. Number two, coherent also improves communication in the body. You gave a great example of fiber optic network. Number three, it has direct effects with greater precision. Number four, it's the same color, the same wavelength the whole time. And here's the giveaway. Here's, to me, the clinical gem. Robust scientific evidence says that this type of laser, red light, infrared, does not help with pain and inflammation, whereas the ones that we're talking about, non-thermal, FDA cleared, does help pain and inflammation. So for me, it's, press the button, game over.
Right. Yeah, I totally agree with you. And we see it all the time. And I think a good marker of this is with sports performance enhancement too. I work with a lot of athletes. I can have a pitcher come in with no pain. I can do the laser on him or on her, and they go out and their velocity's up. Or let's say they're in a batting slump. I can put the laser on their brain, do a few little eye activities. Next thing you know, they're out of the slump and they're hitting home runs and they're leading the league in their stats. Or I can get a runner to come in and get the laser on them. You see them PR. They're running faster than they ever had before. Your sport, basketball, you can have someone who's in a funk and their shot's off, and you use the laser, get on the brain, boom, all of a sudden they're back out there again. And they're jumping higher and whatnot. And you see these measurable outcomes that, to me, are, pain's one thing, but when you can enhance performance, you can enhance brain function, you can enhance the way a person feels for their life, and for feeling younger for a longer period of time. That's some really powerful stuff.
From a patient perspective, because what we do is all about patients.
Right.
Quickly, and you kind of said it, but what can they do to benefit from it? And from a practitioner perspective, why don't we talk about a practitioner? A practitioner who's not beat up and injured is going to perform better and have a longer career, because we want to keep the guys like us with the 25 years experience to be able to show some of the younger docs some things and help patients keep them in the game. So take it from a patient perspective and take it from a practitioner perspective.
Yeah, so let's do it as a practitioner first. So when I was 34 and I was 5 years into doing chiropractic, I felt beaten up because I was working on all these patients, and I'd come home at the end of the day and I'd tell my wife, man, I feel worse than most of the patients do. My back's killing me, my shoulders are killing me, and my wrists, my elbows. And I told her, I don't know how much longer I'm going to be able to do this. And she told me, what do you mean? You spent all this money. How can you not, do this for longer? I said, it's killing me. It's tearing me up. And I went to a seminar here, Dr. Murphy speak. And the reason I went was I used to do workers' comp here in California. And when Arnold Schwarzenegger got elected governor, he promised all of us chiropractors he was going to do great things for us. He's like, guys, hey, listen, my best friend is Franco Colombo. He's a chiropractor, and I want to help you out. So, you get me elected. I'm going to be your friend in there. I'm going to look out for you. First thing he does when he gets in, he signs this work comp legislation that's like, hasta la vista, baby, you're terminated. Ha ha. And next thing you know, reimbursements way cut. He puts a hard cap on our visits. I'm like, man, do something different. So I went to hear Dr. Murphy speak, and they did this computerized range of motion and muscle testing device. So from a patient perspective, here's something objective that measured my muscle strength, measured my upper extremity range of motion and my neck range of motion. Then they took one of the handhelds, lasered my neck. I didn't feel it because it's non-thermal. So I'm thinking, what the heck is this thing doing? And then they measured my range of motion, muscle strength afterwards, and bam, there was a change. So that's where I saw the potential, because I thought, if I can change a person's muscle strength and range of motion that quickly, that's huge from a patient perspective, especially since there's no medications involved. So there's no risk of, addiction. And from a doctor perspective, I can get people better with some tools that can take some stress off of me, because patients, as a chiropractor, they're easier to adjust after I laser them, because we decrease that inflammation, we change the tone throughout the central nervous system, muscles aren't as tight. So we're able to help them out in a much better fashion and give them some tools that they're not really exposed to, that's non-surgical, that's non-pharmacological. And here I am 20 years later using lasers. I feel better now at 54 than I did at 34. Now, I don't have the aches and pains that I did back then, and I'm sure you can attest to something similar with what laser's done for you.
Yeah, with the torticollis, and you've had some, you were a college athlete, you were a contact college athlete, you had some injuries.
Yeah.
But I really want to add a couple of things to the objective. Right, exactly.
Yeah.
You didn't play that long ago. You wore a helmet, my friend.
I wore a helmet, but man, I had a lot of concussions, a lot of concussions.
You and me both. You and me both playing basketball, the non-contact.
Oh, absolutely.
Yeah, without question, but I want to add, you made some really good points about objective. There was a fabulous study on levothyroxine, a thyroid medication. And everybody involved had a reduction over a 9-month period of the drug, and 47% of the people also stopped using the drug.
Yeah.
So that's quite objective, just irradiating the thyroid. There was also a study done on when you're just using the 635 nanometer light about the increase in interleukin 10. So you're turning on the interleukin that is anti-inflammatory, which also concurrently turns down all the inflammatory interleukins like interleukin 1 beta, interleukin 6, interleukin 8, and TNF alpha. So if you want to take laser to longevity, laser is the device for longevity without question, because it turns on the right health switches.
I agree with you. And if I can jump in there on some on that thyroid study, you're talking about the Hoffling study, right, out of Brazil, and they did that for 6 years. And what I think was really exciting in there was it showed the reduction in the TPO antibodies in those patients. And this is really critical, because if a patient goes to a standard endocrinologist and they see those TPO antibodies, they usually don't care. They're like, don't worry about it. We'll just leave them alone. It's going to cause the thyroid to die, and then it's going to be easier for me to manage your thyroid condition afterwards, to give you the medication. What those endos don't pay attention to, and this is my buddy Dr. Datis Karajian talks about this, is those TPO antibodies, they cross-react with the cerebellum. So as this patient is blowing up thyroid tissue, they're also blowing up their brain. And how much brain tissue do you want to lose? So if we can get the laser on these patients and provide support with interleukin 10 and dampen inflammatory cytokines and reduce their TPO antibodies, what does that do to the brain? That protects them. And what are we seeing with cases of neurodegeneration? They're exploding. So we can save these patients from having a really, being one of the 1 in 3 that end up in a nursing home with dementia. And that's one of the really exciting things to me is this is changing a person's life 10, 20, 30, 40 years down the road.
Yeah, without question. Also in that study, it also showed an increase in blood circulation to the gland. And as we all know, thyroid is without question a great example of autoimmunity, which may come from the gut. And you said, great, remember the antibodies damage the brain. So we've got the whole interconnection of the body going on. Truly exciting.
And that study too, remember, it also showed regeneration of thyroid tissue that mainstream docs don't know is possible. The Russians were doing that back in the 70s. They had lasers part of state-sponsored standard healthcare by 1974, using it over livers that had hepatitis and cirrhosis to regenerate some tissue, using it over pancreas, using it over the thyroid to regenerate tissue. So it's actually regenerative too. And I think that's really exciting.
So if we want to talk about things that put the brakes and maybe allow it, like you said, to regenerate or come back or reverse, let's talk Alzheimer's now. Let's throw it out there.
Oh, yeah.
I'll set the plate for you. Here we go. We know that Alzheimer's is a neurodegenerative disease.
Yep.
We know these neurodegenerative diseases have an origin in the gut, go from the gut to the brain, without question. Interesting about Alzheimer's through Dale Bredesen's work in nutrition, and you and I both have piggybacked with the nutrition and added the laser to it. He's shown that you can not only stop Alzheimer's, but you can turn it around. So here you go, buddy. I'm playing quarterback now. I'm throwing the ball to you.
Throwing the ball. Sounds good. Sounds good. A wide open pass there. So let's say I take this laser and I put it on my brain here. If I pulse this at 40 hertz, there's numerous studies that show that pulsing it at 40 hertz can trigger those protein misfoldings, the alpha-synuclein, the tau protein misfoldings, to actually break apart. So you can now start to change that. And the way for people who don't know what those are, think of that as like wires that are getting tangled and frayed and connected. And so you get misfiring. Like if you've got an old speaker wire that's getting raw and it's shorting out and you got to try to move it to get it to make a connection. It'll connect, sometimes it won't. That's like the person with the Alzheimer's, where sometimes like, hey, they seem to be functioning, and then today they're not. Those are all those misfirings there. The laser can actually help to get rid of that stuff and start to repair it by stimulating things like brain-derived neurotrophic factor. And that can have a huge impact in rewiring the brain. And like as you mentioned with the gut, so I like to get the laser and go down my vagus nerve, down to the gut. We'll get one laser on the gut and then my other lasers on the brain. Then we'll have the patient do brain exercises. And we'll do it as easy as whatever they're bad at, we'll have them do. So if it's a memory thing, we might have them do like, say, a Lumosity app while they're under the laser. If their math is bad, we'll do some Sudoku while they're under there. If their speech is bad, maybe some tongue twisters. And here's the cool thing is, with these high energy visible wavelength lasers, Sergei Moskovin talks about how the Russians would use these over blood vessels. So we don't even have to necessarily go on the brain. We can go over the blood vessels because you got things like free floating mitochondria that are going to pick up the energy, and that's going to deliver it to those areas that you activate on there. That's going to go globally throughout the body. Also getting to the gut where you can start to improve the microbiome. There's some current studies showing that the lasers can help to repair the blood-brain barrier, the gut barrier, which we're talking about autoimmunity. We're talking about somebody like me who's had, over a dozen concussions here, and you break down that gut-brain barrier, or your average American who's eating glyphosate, breaking down the gut barrier from glyphosate, you can start to repair these things by using these high-energy lasers.
Outstanding. I mean, I'm pumped, man. I want to go laser myself. And the secret's out. You and I laser each other, or separately. You're in California. I'm in the US, but we use the laser on ourselves. I laser my wife. I know you laser your wife every day. But the gut, there was a great article that came out. I'm not going to say who wrote it. It'll be self-professing. But I wrote an article on a serious note on photobiomimics, the idea of how photons affect the microbiome. The studies, the objective studies have shown that it increases the good bacteria in the gut 300-fold. And to really emphasize what you said before, it helps with the gut barrier. And we all know that a myriad of conditions come from a faulty gut barrier, i.e. leaky gut. So to laser the gut is something that you and I talk about all the time. It's something that people should seek out a laser practitioner for. There are
Right.
objective studies out there. I'm actually doing a study in my office, but that really speaks to the idea of leaky
Oh yeah,
gut, laser, and nutrition. One thing about laser is it's a great standalone device. I know you
it
agree. There's
is.
no doubt
I
about
totally.
it. But it is without question synergistic with anything in
Mm-hmm.
our
Mm-hmm.
treatment armamentarium. That
Mm-hmm.
said, great studies on Alzheimer's. I know you wanted to talk a little bit about ADHD.
Oh
So
yeah,
again,
absolutely.
I'm going to bounce the ball under the basket.
All
Let's
right.
get to.
Yeah, yeah, and that one's close to my heart because it's something I've struggled with since I was a kid. I mean, technically, I would what you would label as neurodivergent because I had Tourette's as a kid, I had ADHD as a kid, sensory processing disorder. Like I'd have it where if something touched me on one side, it would kind of drive me nuts until I had it balanced on the other side. I could mask it, and people didn't know what was going on. Even going through chiropractic school, I'd have where I had the urge to do just involuntary movements, but I could mask it and keep it in until I got home. What's been really cool about the lasers for me is that it's helped me to harness that stuff to where now I can do a lot of things. Now, if I get touched, it might it might bother me, but it's not making me like lose my mind, kind of. And as far as from an ADHD standpoint, from the time I was a kid, I was highly disorganized, and teachers always said, "Oh, he's got so much potential if he can just focus, just focus." And people would tell you, "Why don't you just focus?" And in my first 5 years in out of school, that gave me a problem with trying to get my act together for practice. I'd go through these things where I was doing really great and not doing quite as well. And when I got the lasers, one of the things that Dr. Murphy said back in 2004 was, as a doctor, you should be using the laser on your brain every day to keep it sharp so you don't succumb to brain decline with the rest of the population. And so I started using it on myself. And that's when I noticed these things that were plaguing me from the time I was a kid. I can now use this hyper focus in a positive way. ADHD, it kind of calmed things down a lot and allowed me to harness it for good instead of destruction. Basically, I was
Right.
like getting a wild bronco and taming it. And we see this in the office too. Kids who have ADHD, to where they're able to focus better, able to read better, and even with autistic kids. I had a girl come in just last month, 4 years old, had been nonverbal. By the fourth session, her mom comes in and said, "You're not going to believe this. My daughter not only said a word, she said a sentence." So what did she say? She never said mommy or daddy. She said, I asked her a question and she said, "I don't know." And she said, that proves to me that I know my daughter has been in there the whole time. She would just get
Wow.
frustrated because she couldn't get things out. And now she's actually saying things. So you see how much did that change that little girl's life, that mom's life. She was so excited. And now, as it's dampening the inflammation in her brain, rewiring things, reconnecting things, she's able to eat more foods. Like she said, yeah, she's not as picky. And this is after just, we'd done 3 sessions. She was here for the fourth. So I know you see the same kinds of things
Yeah,
with
I
patients.
unfortunately don't have as much ADHD as you do. I get a little bit more of the gut. I get that
Mhm.
neurodegenerative issues.
Yeah.
Again, I like to mix the laser with the nutrition as well. You do, but the great story. I mean, I'm
Yeah.
just heartwarming because, like
Yeah.
you said, I mean, it's you suffered it. It's hard to focus. I see a lot
It
of
is.
people walking in
Mm-hmm.
that it's hard for them to focus. I'm a little different. I'm a
Mm-hmm.
type AAA. I'm just, off the charts,
Yeah.
jack out of the box kind of thing. So
Barely sleep and everything. Yeah. Right.
yeah, I know you can
Yeah.
call
Yeah.
me
That's good.
anytime. It's all good, man.
Exactly.
That's
Yeah.
that's
Exactly.
that's the crux, maybe the bane of my existence, not getting enough sleep. I fess up to it. Um, let's talk a
Mm-hmm.
little bit about the different lasers, the colors, and what you may want to use for neurodegenerative disease, because without question, no pun intended, the brain is hot.
Yeah.
Although we shouldn't make the brain hot. Maybe we
Right.
should cover that. Remember, the brain does not like heat,
Yeah.
fever. So let's jump in that.
Yeah. Yeah. I think that's a really important one to look at because, like I said, you and I have good 4 decades of laser experience between us. So we've gone through, we read a lot of research. Unfortunately, a lot of times practitioners don't read much research and they just jump into stuff and they listen to what the sales rep told them or what they hear a lot from, like, say, an influencer online who may not have all the details. And I see this
You
with
want to
some
share a
people. I
few
see them.
names?
Yeah, well, stay, I'll stay out of that. I'm not
Oh,
sharing any
come
particular
on.
names. Yeah.
I don't mean to interrupt you, but like, can we
Yeah.
share a few names? I mean, there's a couple of guys that have 1 million followers that name names and do pictures. So if you want to go,
Yeah. Yeah.
uh,
Yeah. It's. I mean, though people will know when I say this because there's one particular doctor who's lighting kids up with a laser that's really like a thermal laser. It's infrared, and he's having kids doing treatments for an hour at home. And so you're putting a ton of low energy, but thermal and thermomechanical types of photons into the brain that actually goes against even the world guidelines on there. And he even is in videos saying, oh, I know this is against guidelines, but I think I know more basically than everybody else. And here's the problem is that we're already hearing reports of kids having seizures from these kinds of treatments and getting worse. I know Dr. Brandon Brock, who's one of our neurodocs in Texas, has had some of these patients show up and knows of one that had a psychotic break because a thermal laser was used with a high dosage for a long time on that man's brain. And heat can actually create damage. The paradox is temporarily, you can get some enzymatic reactions that can make the patient look like they're having an improvement temporarily. But we look at studies even just on imaging, like let's say on infrared laser imaging for the brain, they warn about if you're using particularly a continuous wave laser at certain milliwatts to wattages on there of what it can do temperature-wise of increasing it, 10 degrees Celsius is the threshold, especially in kids. So that's what anybody who's listening, watch out for anybody who's going to use something. If you can feel heat with that, that's not what you want going on your brain. And we're not saying this to prevent people from buying other lasers. We're just looking at it from a safety standpoint. Absolutely. That you don't want to see someone getting injured from something. We see, reports of this in some of the forums where I know there was another high-powered laser used on a patient's TMJ, very high setting for a long time, and not only did thermal damage to her trigeminal nerve, to where the girl's now suicidal and she's only 27 from what was done. That doesn't happen with our non-thermal lasers used at an appropriate low dosage on. So I think that's important for people to understand that.
Great takeaway. Great takeaway. Musculoskeletal injuries, sports performance. Let's glean over that a bit.
Oh, so this one is just, this is just my favorite thing because the proof is what the athletes say. To where I'll give you an example. I had one kid who came in, he's a football player, came in for a low back pain injury. And then he stuck around, he's coming down on a weekly basis every day before game day. And his parents said, hey, you know what? He's feeling great. We want to take this week off and see how he does without it. I said, great, let's do a little trial, see what it is. He takes that week off. His parents call me on Monday and say, you know what? That's the last time we do that. I said, why? What happened? They said, when he was coming and getting the laser, he would go through all 4 quarters and he'd be done. And he'd say, I feel like I can do, overtime. When he didn't get the laser, they said, 4th quarter, you can see he hit a little bit of a wall. And he wasn't in pain, but his performance was a little off. His reaction was a little slow. He was a little sluggish. And so they said, that's it. We're not doing that again. Every time before game day, we're going to come in and get this done. And there are studies that show this, one in the Journal of Biophotonics, another in the Journal of Athletic Training, that this is the cool thing, is it showed that the athletes who got laser therapy performed as if they were taking performance-enhancing drugs.
Right.
Bigger muscles, stronger muscles, faster time to recovery. And they even said, we're not sure this should be allowed in the Olympics or international competition because it gave these athletes an unfair advantage. And who doesn't want that? Even if you're just out on the golf course with your buddies on a weekend or on the pickleball court, you still want to beat your friends and your family, but especially if you're a competitive athlete. And this one takes me back to when I worked the Dodgers and Angels fantasy camp. So I was working it there, and there was a trainer from the Rangers was there, and another guy had been the head trainer for the Dodgers for 25 years, this guy named Snake. And they were real skeptical of lasers, even though I ended up having an hour-long line before we started. I'd worked through lunch, an hour-long line afterwards. I was super busy using the lasers to enhance throwing, enhance batting, enhance running. And at the end of the week, I talked with the guy who was from the Rangers. I said, hey, man, do you guys think that you'll add lasers in? And he said, well, we have a laser, and our ace pitcher swears by it. He says that it helps keep his velocity up, his control is better, he recovers faster, and he feels like it prevents him from having an injury. So maybe we'll look into it. But they didn't really do it. And the thing that really killed me is guess what laser he had? He had Erconia lasers because Erconia used to be based in McKinney, Texas, and Erconia had gifted the Rangers a laser to use. And here you have it to where his, main ace for the Rangers back in 2014 was using it, and he didn't listen to roll it out to the other players, which just blows my mind. But you see this resistance because people say, well, it's just a laser, just a light. What's it going to do? And regardless of what results you see, sometimes it's still hard for people to believe that. And it boggles my mind. Like last year, I got invited to go out to the Lakers training facility and to introduce it to their trainers. Their head strength coach, he got it. He understood. He didn't have any pain, but he had some pain when he would do heavy squatting. He had some pain. He couldn't do his PR. So I lasered him. I said, go. He was going to squat that night. I said, report back to me. Let me know how you did. He called me. He said, dude, that was amazing. I had no pain, and I was able to do my PR again. So we guinea pigged his wife, Bethany Flores, which she's on the Laser Light Show podcast, and she's got a little testimonial on my site too. And she had had chronic pain from the time she was 12. When she was a gymnast, she had to stop doing that, and then she became a professional CrossFitter. But her pain would be an 8 out of 10, and last year she hadn't been able to do CrossFit. So what we did is we gave her the GVL to take home for 6 weeks, and she did the FX once a week for 6 weeks in the office. She was completely out of pain in 6 weeks, competed in the CrossFit Games, and finished 15th in the world. And
Great.
she said CrossFit Games, the World Championships are brutal. People go down with injuries left and right. They're in a lot of pain. She said she was a little sore. That was it. And so straight from the words from the mouth of a professional athlete, high level athlete, going from not competing 1 year because of pain. And she said, hey, if you can get me from an 8 to a 7, I'll be happy. We got her from an 8 to a 0. Now, she was doing other therapies too, but they were stagnated. Like you said, when we added the laser on top of everything else she was doing, that was like the magic breakthrough moment for her.
Great scenarios that transpired. That's excellent. You know, there's nothing like a doctor-patient testimonial to really motivate and allow the whole interchange to become vivified. For me, what I like about the laser in a sports setting is that it increases blood circulation. It also increases something called VEGF, vascular endothelial growth factor. It also turns on and off macrophages to be more effective in cellular debris cleanup. It's also shown to really help what we call extracellular matrix, everything outside tendons, cartilage, and ligament. Doc, I know you know this, but did you know, everybody listening, that a tendon never goes back to its original histological length unless treated? What better than applying something that heals at a cellular level than a low-level laser therapy? In addition, the brain, fascinating, to treat a lot of concussions. What does it do for the brain, the laser? Well, it decreases brain inflammation. It decreases brain edema. It increases, as you so well described, BDNF, brain-derived neurotrophic factors. They allow for brain neurogenesis. They're like the miracle grow to the brain.
Exactly.
For the brain to wire together so it now can fire together.
Exactly.
In addition to that, it also decreases the incidence of excitotoxicity. It closes that synaptic cleft down. So everything that happens from a concussion can be reversed by the application of low-level laser. Then you add some of your training, like you talked about before, add some strong nutrition. You've got a protocol that's really strong and applicable to people who are suffering from a concussion. How many patients have said to you, hey, I had a concussion 10 years ago. What can you do for me now? Wow.
Yeah, there's a lot. There's a lot. Or there's a lot who just given up, who, let's say, they didn't tell me they had a concussion. You know, a lot of times patients leave things out of their intake, especially they might come here and think, oh, he's a chiropractor. He's just going to deal with my spine. And they come in and get laser on their neck. And then they'll say, hey, doc, you know, can this thing help with my whole concussion? Because I'm noticing I had this brain fog since I was 14 and I was on the football field. I had this kind of fog there and it feels like it's lifting. And so I see this all the time. And especially in the post-COVID world, we see people who, after an infection, or some of them who have a reaction to a vaccine, that they get this brain fog afterwards, or they get this chronic inflammation. And we see them improve with the laser, which is really exciting, especially when might have been a couple of years that they had just been told, you're going to be stuck like that. We don't have a treatment for it. And we do the laser and boom, you increase that mitochondrial function. They're getting energy produced. Like you said, you got the miracle growth going, dampening inflammation. You're resetting the immune cells. You're balancing out those glial cells in the brain so they're not attacking healthy tissue, and they're just trimming up the damaged things that need to be pruned. And it's just amazing changes people get.
Yeah, you know what? The glial cells, the microglials, the smallest one, it switches them from an M1 to an M2.
To an M2.
So M1, pro-inflammatory, M2, anti-inflammatory, a big change. Unfortunately, women have a tendency to stay in the M1 phase more than the M2 phase. So that poses an issue. You know, really interesting. People ask, because we use a non-thermal low-level laser, they don't feel it because there's no heat vibration. So again, little warning, you may not feel it, but boy, you will get better in a real expeditious manner. So if I had to ask you your 3 favorite protocols for conditions, let's say on label, and then when I say off label, things that are done in empirical research that we haven't been able to document through the FDA clearances,
Okay,
What would you?
sure.
Yeah.
I'd say my favorite things to treat. Number one is going to be anything brain related because
Mhm.
we have the autism study on there, so we know that it's safe and it's effective. And so many people have brain issues that are suffering in silence, whether it's autism, ADHD, and other kind of neurodivergent things like me, or someone going through early Alzheimer's, and they're looking down a dark tunnel. Just getting that laser on the brain, and even laser the brain, and have them just go, or do a vagus stimulation. Man, that's one of my favorite things to do because you see everything improve. I had a patient even the other day just to do a demo on him because he had the cerebral palsy. Because I had him do his range of motion for his lower back. He's super stiff and trouble walking. I did just his brain and then had him do range of motion. He's like, oh my God, I've never gotten this far range of motion because it changed everything below it. So brain's number one. Number two, I love shoulders because I do a lot of sports. And a lot of doctors are terrible at treating shoulders. And a lot of people have had, no luck with them. They've had surgeries that failed. We can do scar reset things with lasers. We can change the range of motion really fast. I'd say number three is knees. People are going to think as a chiropractor, my favorite thing is going to be the back, but no, I love going in the realms where other doctors tend to fail at. And I have patients who come in who've had, say, surgeries that they thought were a failure. And it's not necessarily that the surgeon did the right job, but there's a disconnect between the communication of the brain and the neuromusculoskeletal system that with the laser, we can basically reboot the computer and get everything firing again. And in a session, make a big change in their range of motion, their function. So those are my three favorite on-label kind of things to do. When it comes to off-label, I love patients coming with gut stuff. So, they've got a leaky gut for a long time. I had a patient in here last week with a hiatal hernia who didn't want to have surgery. Laser on the brain, laser on the gut, did some percussion on different areas. Boom, her hiatal hernia pain is gone, and she's like, I don't think I'm going to have surgery for that. Same thing with patients with leaky gut. We'll have them tell us, I can't poop. I'm inflamed all the time. We'll do that same kind of protocol. You can actually see the inflammation go down during the treatment, and they have a noticeable difference right afterwards with their leaky gut. I love that one. Another off-label is going to be definitely thyroid patients. Actually, you mentioned the studies on there. We see them improve with that. We'll have them come in regularly for their brain fog to provide support for that. They usually notice, like in that study, that they don't need as much, medications. They do better than they did before they were having the laser. And the third one, especially as this is an explosion now, is cardiovascular stuff. I've seen some insane things with cardiovascular things. I have one patient who was in heart failure and was told that she needed a double lung transplant and a heart transplant. And she was terrified. They said, you need to get your affairs in order. And part of her problem was she also had this foot that had been swollen for over 6 years. She hadn't been able to wear a shoe for all that time. After the first session, the swelling was gone in her foot. Her pulse oxygenation used to be down as low as in the 50s, and on a good day was 80. Within 2 weeks of doing laser on her, it was up into the 90s. And she was just going crazy that it went up like that. She had been on an oxygen tank, and a few weeks into treatment, she didn't need the oxygen tank anymore. The real amazing thing came 6 months after we did the therapy was when she went back to her cardiologist, who was initially against us using the laser and didn't think it would have any kind of an impact. And important thing, I never said this was going to fix her. I just said this is going to do vascular endothelial growth factor, like you mentioned. It's going to dampen inflammation and modulate some immune markers. Let's just see where it goes. 6 months later, she does a treadmill test and all this imaging with him. And he came out and he asked her, are you still seeing that crazy laser chiropractor? And she said, yeah, why? And he said, well, I don't have an explanation for it, but 6 months ago, you're at 50% cardiac function and lung function. You're now at 100%. And he said, the only thing I can point to is a laser, because he had her on $454,000 worth of medications per year. And she said she didn't feel any better. Every new medication gave her a new side effect. And we did 6 months and reversed all that stuff to where he started pulling her off of medications. And we've repeated that on some other people who had this after COVID or who happen to have a negative reaction to a vaccine. One whose ejection fraction went down to 20%, should be at least 55. He was told the same thing, get your affairs in order or hope for a transplant. He came in desperation, obviously. We had him change his diet, get rid of inflammatory foods, use the laser, put it around the carotid arteries, posterior lung fields, hit over the liver as well, over the brain. 6 months later, what was cool is incrementally his ejection fraction would go up from 20 to 25 to 30 to 35. And his cardiologist was telling him, I've never seen this happen. He said, even with the meds, maybe we'll get 10% back. He went from 20% to 57%. Great. And that was in 6 months, completely changed everything. So those are some of the off-label ones that I love.
Yeah, I'm going to add one on label and I'll add one off label. The
Yeah,
on label, I'm going to take the simple way out. I'm going to talk about lower back pain. 8 out of 10
yeah,
Americans have lower back pain. Got an
absolutely.
FDA clearance for lower back pain. But here's a little specialty item. 52% of people that have discal surgery have a bacterial infection. So
Mm,
to kind of incorporate what you talked about, I laser the gut and I also laser the lower back because there's
right,
something called a gut to disc, gut to joint axis. The
right,
off-label one, which I wrote about in my book, Immune Reboot in 2022, and I think you mentioned before, was long COVID. I used the
right.
laser exclusively because at that time we weren't sure, but now we know about the mitochondrial proliferation. And long
Yes.
COVID, if it's anything,
Right.
is
Hmm.
mitochondrial dysfunction. So everybody
Yeah.
out there that has some shape or size of long COVID, you're not going to have longevity. So go get that treated because
Yeah.
long COVID is probably the basis on mitochondrial dysfunction. With all
Yeah.
that being said, what do you think's the future hold for laser therapy?
I think the future is it's unlimited there. It's going to be something where I think in another, 20 years ago, I thought laser would be everywhere within 5 to 10 years. So it's just people have been slow to adopt it. But as we're doing more and more research on different kind of conditions, I see it as the future of healthcare becoming something much more standard, much more normal to go to, especially as you mentioned the mitochondria on there. And if it's an autoimmune condition, the mitochondrial dysfunctional. If it's aging, mitochondrial dysfunctional. If you got skeletal muscle issues, you got mitochondria issues. If you got brain issues, there's mitochondria issues. If you eat anything with glyphosate, that screws up your mitochondria. Artificial colorings, artificial sweeteners, high fructose corn syrup, many of the most common medications like the Cinepril, metformin, Lipitor, all these things cause a dysfunction in your mitochondria. If you smoke, if you vape, if you drink alcohol, your mitochondria is screwed up, and that affects the longevity of your health. And you need to support. There's 4 steps to making energy, as you know, complex 1, 2, 3, and 4. You need 3 different wavelengths to fully support it because complex 4, red, and you can get some mechanical impact at complex 4 with infrared. But complex 1 and 2, you need violet. That's the unique wavelength. That's like trying to use ultraviolet to cause melanin for a suntan. You need that particular wavelength to change it, and you need that wavelength at complex 1 and 2 to help it. And then at complex 3, you need the green. So I think stacking this along with like your awesome article in Chiropractic Economics, where you talked about the nutritional approaches and the exercise approaches to support mitochondria, I think the future is getting people to see that they have a lot of control over their health, with what they put into their body, with if they move it, if they don't move it, and then if they support it with lasers. That's a huge thing to where you can change things, and big pharma is not going to like it because you can get people to avoid being stuck on some of these meds for a long term if they incorporate these things together.
Big Pharma is definitely not going to like it because those over-the-counter non-steroid anti-inflammatories are one of the things that also decreases
Yes,
mitochondria. And
exactly.
chronic sensitive high levels of pain or ATP decreases, which is
Right.
mitochondria. So we could say everything's mitochondria. And,
Yep.
I definitely want to exemplify one thing. Neurodegenerative disease, which is growing at a rapid rate,
Right.
basis now is mitochondrial
Exactly.
dysfunction. It has
Hmm.
been stated that the utilization of the 3 wavelengths that Dr. Gair mentioned will, without question, stimulate the 4 complexes needed for mitochondrial function. So
Right.
the wave, if you will, of the future is
Hmm.
405, 520, and 635. Dr. Gair,
Absolutely.
we could do this all day. We
Oh,
have to have
totally.
part 2 without question. This is exciting.
Absolutely.
Easy. This is easy. There's nothing
Yeah.
on my pad. We just went
Awesome.
these up and we went to work.
Awesome. It's fantastic.
We got to get you back on. How can people get in touch with you if they need to?
They can get in touch with me through on Instagram. It's at Dr. Kirk Gair. On Facebook, Kirk Gair DC. I also have a group for patients called Dr. Gair's Patients Health and Performance Secrets. You're welcome to join that. Got different tips and different videos in there. My website is laserchiropractic.net. If you're out in the Southern California area, that's where you can actually go and you can see what I do in the office, and you can book an appointment directly through the website.
Outstanding. Well, we're going to do it again. My man,
Absolutely.
my
Awesome.
West Coast brother,
That's
Dr.
right.
Kirk Gair. Rob
East
Silverman,
Coast, West Coast.
here
Yeah.
it is. Always yours in health. You got it, my man.